Hello, it's Dr. Janice Huntingford, and today our topic is on feline rehabilitation. Now, I do see a fair number of kitty cats for rehabilitation, although it is a lot less than the canine species. However, there are some very peculiarities of the feline that we need to discuss, and so this is an entire lecture on feline rehabilitation. So it used to be, these are some statements that we saw in what I would call them bygone years. Two ends of a feline fracture in the same room will heal. I'm sure some of you have heard that. And I'm a 1984 grad of the Ontario Veterinary College, and I know I certainly heard that. And at that time, really, it's just a cat, and you can always get another cat. The other thing is cats are really small dogs. People won't pay to treat cats. Cats don't get arthritis. You hardly ever see them limping, and you can't do a lameness evaluation on a cat. All of these are false statements, quite obviously. And our relationship to cats and people's willingness to have cats as the number one pet in their life is really increasing. In fact, there's 95 million cats in the United States, and the funny thing is that more than half of them will never see a veterinarian. Orthopedic disease, particularly osteoarthritis, has a prevalence of about 90%. And I think this is something that really very much goes undiagnosed with kitty cats. Funny thing is, though, that when we think about it, cats make better orthopedic patients than dogs do because they are lightweight, they have straight bones, and there's very few genetic musculoskeletal diseases that cats are subject to. But they do have some differences that we need to think about. People don't think about cats getting hip dysplasia or luxating patellas, but both of those things are seen. And kitty cats can get tendon and ligament problems, and we'll talk about those. So these are common feline orthopedic issues that as a rehabilitation practitioner, you may see. Now, femoral fractures, including fractures of the capital physis, are some things that are seen, and a lot of those are post-traumatic, car accidents, falling off of things, attacked by a dog, something like that. So that's where our fractures are going to be. However, you can get fracture of the femoral capital physis in young male cats that are heavy, like Maine Coons and things like that. They can have spontaneous fractures of the capital physis. So that's something that's kind of an interesting thing to do. We do see cats with Achilles tendon ruptures. We do see cats with cruciate ruptures and that have hip luxations. And this is going to be the most prevalent disease, however, that we see in kitty cats. And that's going to be as far as orthopedic things go and for rehab, and that's degenerative joint disease. Most cats, if they live long enough, will get some form of osteoarthritis. And some of these other things, polyarthritis of all types, elbow dysplasia, these are certainly seen, but they're not seen as commonly as degenerative joint disease. Now, when we think about degenerative joint disease in dogs, we can understand about how that looks. Cats are just different. The other thing we need to think about when we talk about cats, that's not on this list because it's really not an orthopedic disease, but it's IVDD, intervertebral disc disease. It is actually rare in cats. It's rare. Very common in dogs, but very rare in cats. So if you see a cat who has a back problem and back pain, it could be IVDD, but it could be something else, and it may just be that the cat has arthritis. So when we assess the feline patient, that's an important thing. It's important to think about how we do that. And sometimes owner's history is not very helpful. And the reason is because the cats are so good at hiding their symptoms, and many times these cats are outside, so the owners are not observing them. If there's a traumatic event, most of the times the owners didn't see it. And cats are often difficult to assess when they're in the hospital. They're in their carrier, they're just sitting in there, and they're not going anywhere. So I always leave the cats in the carrier while getting the history, and I will have the door of the carrier open. Oftentimes I'm going to cover that with a towel that's been sprayed with something like Feline, which, if you're not familiar with Feline, it is a feline pheromone spray. You don't spray it on the cat, but you spray it in carriers, and you spray it in around areas that cats are going to be, so it makes them feel better. So here are the questions that I like to ask my cat owners. Is the cat indoors or outdoors? Less likely we're going to have trauma if the cat's indoors rather than outdoors. The vaccine status, I want to know if it's been vaccinated for rabies. Is that a possibility? Is it possible that the cat has contracted feline leukemia, maybe from another cat's bite? So I want to know that. Is this an acute or chronic disease? Has this been going on for a long period of time and therefore it is an issue? Or has it something that's just come up? Now, if the cat is ambulatory or not, it's always a good thing to ask the owner that, because sometimes you don't know. The cat's in its carrier, it's not moving. So it's good to know what the owner is seeing. Obviously, urinating, eating, behavioral changes, limping, lameness, jumping, interacting with the family. Those are all very important things to know about the patient. So, but here are some other things that can be a possible indication of orthopedic disease. So litter box changes. Many times these cats, particularly with osteoarthritis, have a great deal of difficulty getting into the litter box. They can look like this cat here, which has kind of awful looking grooming. And many times decreased grooming and mats are something that we're going to see with kitty cats that have pain, particularly back pain. Excessive licking, if they're pulling out hair, at their tail base, they may have fleas, but they may be painful there. If they're pulling out hair on their arm, they possibly could have tingling going on in their front leg, in their spine, down to their foot, and the only thing they can do is chew. So sometimes they're going to be doing that. Or cats may have constipation or incontinence. Constipation, if they don't want to poop because it hurts to get into the pooping position, that certainly is something that can indicate that this cat has orthopedic disease. The feline musculoskeletal pain index is something that's relatively new. You can go online and download this at painfreecats.org. It really was developed by North Carolina State, by their College of Veterinary Medicine, and it is a scale for scoring the degree to which a cat is suffering from pain associated with a chronic musculoskeletal disorder. And it really is set up for clients, but there is a veterinary section as well. And so I would suggest that if you're treating any cats, particularly if you're going to be doing feline rehabilitation, that you familiarize yourself with the feline musculoskeletal pain index. It is a great tool. It does talk about clinical features with the cat's mobility, how agile it is, and everything really relates to chronic pain in the cats. So if we are, we're doing that, we have a pain score on our kitty cat, and then we are looking at what are we going to do to actually do a physical exam on this cat. Well, I kind of like to have a stress-free environment set up for my cat. So we use a lot of feel away. We have comfortable places for the cats to sit, to lay. We use safe and gentle handling techniques that really are promoted by the American Association of Feline Practitioners. And we also subscribe to the fear-free practice methods, which means we really want to do minimal restraint and we do no scruffing. Now, when I talk about this, people also ask me, well, how can you, scruffing is fine to do. Sometimes you have to do that if you're in a dangerous situation and the cat is going to hurt someone. Occasionally you have to use it, but we use it very, very, very minimally. Very infrequently do we scruff our kitty cats. It's important that the cats relax because I want to do an orthopedic exam on them. I kind of want to do a gait exam on them. It's great if you have technicians who really like cats. You have to book enough time for this examination, and you really need to have the right space. If you have cat toys around, that is very, very helpful to have cat toys. So we have a little cat waiting area, cat exam room, and we're going to have cushions. It has a window. I do have a bird, although sometimes the bird is noisy and the cat is kind of afraid of the bird, but I think an aquarium is probably the best thing to do. It's good if you have areas that are lower or that are higher. The cats can jump here, they can look out the window. Pillows, cushions. We have an area with a couch as well. So that's a great place for a cat. They don't necessarily need an exam table, and they may not even necessarily like an exam table. So here is a question that I always get asked: how do you examine aggressive cats? Want to be sedated. So it's great when you can play the Ramones, right? Well, so we do sedate the cats. If we're having an issue and we can't examine them, we will sedate them. So here's what we look at using. We look at using gabapentin, about 100 milligrams given at least 90 minutes before the exam, and that's going to work well. It does help to calm them down so that we can examine them. It doesn't work very well to try to do gait exams on them after that, but a lot of times for the gait exams, what I really prefer, if I have a cat that's going to be coming in that I know has a chronic, painful problem, I will ask the client to video that cat at home, because for the most part, I'm going to get much more information if they're videoing the kitty cat at home. So, if we really have to sedate them for radiographs, we're going to use some low-dose dexmedetomidine and combine it maybe with an opioid for sedation. And we're going to choose the opioid based on the predicted degree of sedation and analgesia required. So butorphanol is going to be short-acting. Sometimes we can just use that if we need to snap a quick picture. We can add things like benzodiazepam, and we can add ketamine if further sedation is needed, but we're not going to use that with cardiac issues. So here's a few physical exam pointers that we can use for our kitty cats. We want to have a look at the cat covertly. So if the cat likes to sit on the scale, this is a cat sitting on an examination scale, on a weighing scale rather, and he kind of liked it, so we just left the cat there. But we will leave them in their carriers as long as we can. We hope that they're in the room long enough that they'll come out and walk around so that we can just observe the cat when the cat does not think we're looking at him. We're going to take a thorough history. I'm going to find out what long-term medication the cat's on. Is this cat hyperthyroid? What kind of other issues does it have? Does it have kidney disease? All of these things are important, not only because they're going to affect the musculoskeletal system that I'm mostly concerned about, but also I kind of want to know if I'm going to put a cat on my treadmill if it has a heart condition or if it's hyperthyroid. And the last thing is just understanding the owner's goals and the problem. Because a lot of times these cats are having problems and the owners have not been able to communicate that to their veterinarian. They've not been able to get any kind of satisfaction with this because when they take the cat to the veterinarian, the cat won't do what it is that the problem is. So we need to understand what the problem is. So here's what I always think you should do. You should focus on the comfort of your patient. So you want to examine them where they're comfortable. And remember that the cats have two sides. So if the cat's limping on his right front leg, be sure to examine the right hind leg and the left hind leg and the left front leg because they have two sides. And you need to watch for your patient's response. And some of them are going to respond like the cats in those pictures, when I was playing the Ramones, we want to be sedated. But sometimes the cat's eyes will just dilate and their tails will swish. So it's good if you have a great technician who can help you with this and who's very savvy as to what cat behavior is like. So here's some other orthopedic examination observations. Remember with these kitty cats, we want to remember body condition score and pain score. And before touching the cat, observe it at rest. And all the cats can be comfortable. They need to be comfortable in order to observe gait. And that can take a long time. As I say here, as I was saying previously, owners' videos can be crucial. So what are we looking for when we watch a cat? Well, we're looking for some mentation and behavior. Obviously, we would expect the cats to be having normal mentation. If they don't, then there's something systemically wrong with the cat. And as far as behavior goes, if the cat's painful or fearful, you're going to get a very similar response. For posture and gait, what we're looking for is reduced weight bearing, some atrophy perhaps, or asymmetry. And here is a cat. Let's see if my video will play. So this is a cat by the name of Elvis. And Elvis has osteoarthritis. And the owner did this video. We'll see if we can get it to go again, because this is the problem with owner videos. They don't always look great, but this cat is having a hard time going up and down the stairs. Now, this is another video of Elvis outside, and as soon as Elvis walks away, you will see what's actually going on with him. But the history on Elvis was that he had problems going up and down the stairs. He had problems walking around. He obviously did not have any problems eating, because there he is eating. But here, see, here's poor Elvis. Very, very stiff when he's moving around. Particularly having some issues with that right hind leg, right? He's not bending his stifle. He's just kind of moving that leg with much more difficulty than we would like. But this cat, Elvis, in my exam room, didn't want to move at all. I couldn't do anything to get him to walk, and I would not have known anything about Elvis if the client had not videoed him. So this is the lameness scale that we use for cats. I have a different one for dogs, but this comes from the book Feline Orthopedic Surgery and Musculoskeletal Disease. And this is the lameness scale. So grade 1, we have low grade lameness, hardly visible, or the cat might just be lifting his foot. We have grade 2, where the lameness is visible, but the leg is used in most steps. And then we have high grade lameness, where the cat's only toe touching. So Elvis would have been a grade 2. So here's a kitty cat that's just lifting its foot. So it's kind of got a grade 1 lameness. If you're looking at the gait of cats, you need to be patient. You need to give the kitty cat a space and a surface to walk on. Place the cat in the middle of the room and encourage it to walk. I like window ledges. Sometimes you can see those big ledges in my exam room. Sometimes those are a great place to get the cat to walk along. And foot lifts, like this cat's doing here, foot lifts are important. If the cat has bilateral orthopedic lameness, he's going to walk with a crouched gait, but not often a distinct lameness. And the examples of this are going to be things like hip dysplasia, patellar luxation, bilateral cruciate disease, or lumbosacral disease. And obviously, if the cat actually can't stand or walk after trauma, he's probably got a fracture. So cats with orthopedic disease are unlikely to come into the clinic for a classical lameness exam like a dog would. And when the clients present a lame cat, there's always a disease process present. Always. And this cat has a plantigrade stance, and he did not have diabetes. That's always one thing that we worry about. And of course now he's walked away and we can't even see him. So gait evaluations, if you've seen some of my other videos, you've seen dogs doing cavalettis, and these are cavalettis. Cavalettis are really good to help evaluate stride length and compare joint flexion and extension angles while the cat's walking, or navigating obstacles. And here is our kitty cat. And he's hopefully going to walk over our obstacles for us. He did very well, indeed. So here's our other little cat again. So a cat may unload a painful limb even at rest. And if you can observe the cat's sphinx lying, you can tell if he has asymmetry or if he has an inability to flex the hock, the stifle, the hip, or the elbow. So a lot of times they will kind of sphinx lie for you. If they have a unilateral thoracic lameness, they will have a head bob. The head's going to go down on the sound limb and it's going to come up when the affected limb is going forward, because you're trying to decrease the load off that limb. So if the limb is down, your head goes up to pull the load off the limb. Hardest cats are the bilateral lameness cats that have short, choppy steps with affected limbs and weight shifting. That's what you're going to see with them. It's difficult to tell when they have both of their legs. But unilateral pelvic lameness, you'll get a hip hike, and oftentimes I notice what's going on in the pelvis by the tail, because the tail is going to be used asymmetrically to shift the weight towards the more normal side when the cat's in motion, because you're trying to shift the weight off of the lame limb. So watch cats' tails. And how about a plantigrade stance? Well, I already told you that this kitty did not have diabetes mellitus. So the differential diagnosis, this is what we see orthopedically, a peripheral neuropathy, including diabetes mellitus, and that's diabetes mellitus, not degenerative myelopathy in cats. So peripheral neuropathy, including diabetes, lumbosacral disease, avulsion of the gastroc tendon, a ruptured common calcanean tendon, fractured calcaneus, or a disruption of the long plantar ligament. So all of these guys here really are orthopedic issues that relate to right in this area, whereas these two do not. So in actual fact, what was wrong with this cat? This cat had lumbosacral disease. So standing palpation doesn't look like the cat's really standing here, but it's not lying down. So what we like to do is simultaneously palpate all of the joints and all of the muscles. And I like to run my hands down the spine and palpate that. I'm going to do full extension and flexion of the neck and the tail. And I'm flexing the tail because I'm looking for lumbosacral disease. And after an asymmetry check, then I'm going to put the cat in lateral recumbency if the kitty cat will allow me to do that. But you would be surprised the number of cats that I see who have very, very painful backs and have been previously diagnosed with feline hyperesthesia, which was thought to be a skin issue, but their skin is rolling like all along here, and they really don't want you to touch them. So many of these cats we have later diagnosed with back pain, and some of them have actually had some arthritis in their spine or arthritis in their limbs. And so the whole time the client thought that the problem was the skin, but the problem wasn't the skin. The problem was that the cat was painful. So here's a few more thoughts on feline joint palpation. The feline joints are a lot more elastic than canine joints. And this is important to note that the feline cranial cruciate's thicker than the caudal. And when we compare the range of motion on each joint, we really want to compare it to the contralateral side, because if we're doing range of motion with a goniometer, we do have normals for dogs, but we don't really have normals for cats. So I do like to do both sides, and then I can compare it. And if I get a hip extension in a normal leg of 140 and I get it, 137 in the other side, well, both of those are probably normal. Whereas if I get, 142 in one side and 110 in the other, that's easy to tell, but you want to compare them. The other thing is, if you have a collateral ligament sprain, you will get periarticular swelling. That's something that people don't really think about, but if you're getting periarticular swelling and it's not a cat bite, it could be a collateral ligament sprain. And a lot of times we need to be sedated. So joint examination, we're going to move all of the joints and the digits, and we don't want to forget about the claws. Looking at the claws is actually quite interesting because we can tell many times what the cat's been up to when we look at the claws. If the cat's been in a car accident, many times the claws will be shredded. So we want to have a look at that. We want to test our cats for ortolani and cranial drawer, and because cats can get hip dysplasia, and patellar luxation is not uncommon in cats, so I do see that. And the biceps tendon test is also valid in cats. So the ortolani, that's not what I'm doing here, but if you were to do an ortolani, you would put your thumb here, but you're going to flex the stifle to 90 degrees, and then you're going to put the stifle towards the midline, and then going to abduct the femur with your thumb right at the greater trochanter. And if it's positive, it's going to be pushed down. You'll feel a little clunk. And that's your ortolani test for hip dysplasia in kitty cats. With the biceps tendon test, you actually are going to flex the shoulder, not extend it, and palpate right here where the biceps tendon is. And if that's painful, then that's a positive test for that cat. So neurological exam, a lot of times it's easier. First of all, you have to do it before sedation, because if you sedate the cat, you're not going to get anything on the neurological exam. But you want to do it before sedation, do the non-painful tests first. And often with unilateral leg lameness, knuckling and dragging one leg, arched back, low head carriage, that's what you're going to see. But when I check reflexes, we do it with the cat on the examiner's lap, so that they're sort of dangling a little bit like that, and I can pinch the toes and see if I'm going to get a patellar or if I'm going to get a withdrawal reflex. And then I can kind of do a little snapping, a little bit, perhaps with my stethoscope right on the patellar tendon, so that I can see if I'm going to get a patellar response. So here's a few more thoughts on feline neurological exams. Remember that cats aren't small dogs, and wheelbarrowing in cats is very helpful for assessing proprioception. You can also hop them, but wheelbarrowing works a little bit better. And conditions that are common in dogs are rare in cats. Not always, but IVDD certainly is. And these are the 4 most common causes of hind-end paresis in cats. Aortic thromboembolism is probably, and trauma I would say would be the number 1 that I see. And then after that, aortic thromboembolism, neoplasia, and FIP. But when you see these, because these kitties are systemically ill and they need more than just rehabilitation. Many of them need surgery or drugs or other things. And I apologize for the quality of this video. Someone sent me this, Animal Ortho Care actually, showing the cat with the Achilles tendon rupture before and after the brace. So this is obviously our Achilles tendon rupture here. And again, I really apologize for the quality of this video. It's just not great, but you can see that on the right leg. And this is the brace here, right here. At least the brace has a little blue, so you can sort of see how it works. And this is a bit of a dynamic brace. But as you can see, the cat's joints are up more than they were. And again, I apologize for the quality of this video, but it was the only one that I had with a cat with an Achilles brace. So how about traumatic orthopedic disease, soft tissue cruciate ligaments? Not a common finding due to the cats, but can occur, and it's usually due to trauma. Sometimes it's associated with luxating patella, and radiographs can be helpful. And sometimes they say you need arthroscopy to confirm. So conservative versus surgical management, I have some very strong feelings about not doing surgery on these cats unless they also have luxating patellas, which are painful. Then I think you probably need to do them, but I don't think there's a reason to do surgery on these. These will heal. They're great to do conservative management on, and I know some people are even doing TPLOs on these cats, and I think that's super overkill. But if you're going to do surgery on them, these are the surgeries you can do: extra cap stabilization or TPLO, cranial wedge, TTA, and the results were all good. But it doesn't, this was from a surgical paper. What it doesn't say is that conservative therapy, the results were also good. So here's what I'm going to do. Conservative ligament injury in cats, if I'm going to do conservative management, first we're going to do weight control. Many of these cats are overweight and they need to lose weight, and we're going to rest them a little bit. If you remember from our wound healing lecture, or maybe we haven't had it yet, I'm not sure what order it's in, but you probably have. If we're looking at ligament injuries, it takes a long time for them to heal. And they do need some exercise, but they need some protection as well. So cats actually are pretty good at protecting themselves. I like to use laser and I like to use acupuncture with these kitty cats. Of course, we treat their pain with NSAIDs, gabapentin. We'll use some joint supports, and Adequan is also something that can be used. We do put them in our underwater treadmill, and we do exercise therapy on them. And some of them who have very minor ones will have normal gait, within 6 weeks. If they have a complete rupture and they're really painful, it may take longer than that. But I have had them where they've felt much better within 6 weeks. So hip dysplasia in the cat is an inherited condition that we will see, and it does have a higher incidence in purebred cats. And the clinical signs are sometimes vague, but many times the cats are just inactive, lameness. We will get crepitation and pain on palpation of the joint, and we also will get muscle atrophy. And this is what a cat hip dysplasia looks like. It's different from dogs. The acetabulum is very shallow, and there can be some subluxation of the femoral head, and you'll get DJD changes later. And they're also going to involve the cranial dorsal aspects of the acetabulum. So anyway, treatment is weight control, steroid, Adequan, omega-3 fatty acids, and it says here FHO salvage procedure. You can do that. I like to do acupuncture and rehab these cats. This is a cat that is post-FHO, and this cat, unfortunately, somebody put a needle through the sciatic nerve of this cat. Its left hind leg is, as you can see, we have a TheraBand on there, and we're pulling that forward. But this is an unfortunate thing for this cat. That he needed somebody better to do an FHO on him. But this cat, we never did get back 100%. He became much better, but he was never 100%. So degenerative joint disease is what we're going to talk about mostly, and the rehabilitation of that. We have to remember that the joint is an organ that has a synovium, synovial fluid, ligament, fat, and DJD is really a final pathway for a failing organ, and it involves the whole patient, right? Because abnormal forces on a normal joint, normal forces on an abnormal joint, those are pretty standard for DJD. And, they have pain, reduced function, joint stiffness, atrophy, their biomechanics aren't good. And the big thing is that they have decreased quality of life, and many of these kitty cats are obese. And this simply shows this was from a DJD paper, and it simply shows that as the cats age, this is the appendicular osteoarthritis, and this is the axial. Between 15 and 20, this was the number of cats that they had in there. They had 25 cats in each group, and that was the number that had DJE. So that's kind of an interesting thing. And there was another study that was done on the prevalence and classification of chronic kidney disease in cats, and 68.8% of them had degenerative joint disease. So that's pretty significant. So here's a little kitty cat. You can see this cat, he can still move, but he's pretty sore. He needs some help. So how are we going to help these guys? Well, treatment challenges, of course, with these cats. We have to remember that degenerative joint disease is a long-term commitment from the owner and also the veterinarian. Some things work and some things don't. But there's a huge role for rehabilitation here as far as non-drug things to use, because there's still not a lot of drugs that we can use in cats. There are some, but we can integrate a lot of rehabilitation modalities. And here's our cat doing a little bit of dancing backwards. And then he's going to dance forwards. This is just a little bit of a weight-bearing exercise. So we can do things just like we can with dogs. Hot and cold therapy, hydrotherapy, laser. We can do manual therapies and therapeutic exercises. So I think we've seen this cat walk over cavalettis before, but this cat does a really good job of his therapeutic exercises. Now, cats love manual therapy. I do some chiropractic on them. They like chiropractic. They like massage for the most part. And cats love acupuncture. I really feel that cats respond better to acupuncture than any other species on the planet. So when we talk about what exercises are we going to do with cats, because we can do therapeutic exercises with them, there are only a few that we're going to go over, because you can't always get the cats to do the exercises you would really like them to do. But cavalettis is something that you can do. You have to put the bars onto the ground for the cats for the most part. The last cat we saw, we did have our cones up, but many times we have to put them on the ground. And they are going to work well for proprioception, for balance, and also to get the cats to flex and extend their joints. And this is really great for geriatrics, because the flexing and extending of the joints makes the joint fluid pump through the joints. And we need to remember that motion is lotion. So the more that we move, the more that we can move. And that's very, very true with cats. And getting cats to move is a huge thing. So that's why I think this is a great exercise for geriatrics and also for neurological cases. Now, if you have an obese cat, sometimes it's not so good to try to lure them forward with a treat. But sometimes you can do that. Many times, though, you can use things like feathers to lure the cats to go over the bars, or you could use a laser pointer, things like that, because we want these cats to be moving. The problem with there's a huge problem with feline obesity, and a lot of these cats will end up with degenerative joint disease. So, as I said, exercise is good for all bodies. So this is a cat that is being wheelbarrowed, and we do use that not only for, we do use that not only for diagnostics, but we also will use the wheelbarrowing as a front leg exercise. And the cat on the other side on the disc, that little kitty cat, we do a lot with this cat because he's our demo cat, but you can use discs and cushions and those kinds of things, because the kitty cats usually like them, and they don't necessarily need a fancy fit ball like this. But you can lift up a leg and they can balance on that. So it's a very safe way to do standing on an uneven surface, so that really works the proprioception. Now, this is our cat in the underwater treadmill, and I apologize that my video is going the wrong way, but this is the cat in the underwater treadmill. And this kitty, so here's what you can do to get your cat to move on a land treadmill. This cat is really trying to get his food. So this does help if you have a land treadmill, you want your cat to exercise, and he can never quite get to his food. But it's just, with cats, it's mostly a lot of tricks that you need to use. So laser is another modality that we use a lot with kitty cats, and we're going to use it for a lot of things in rehabilitation with cats. Wound healing, I think I had, when we did the wound section, I had a picture of a cat that we had done laser on his feet after being burned in a fire. But we do a lot of laser on cats for pain relief and also for edema, muscle spasm, when we want to increase circulation. We have to remember that if we're doing laser, everybody has to be safe. So the cats have to be safe, and we have to be safe. So everybody needs to wear glasses. And of course, it makes the cat look like a rock star. And most of the cats are going to wear these as well. But cats do extremely well with laser therapy, and I do it for osteoarthritis very, very frequently. And so here's a few other things. So here's our laser, and then this cat that's laying down at the top, I'm actually doing some chiropractic on that cat. That kitty cat comes in to see me very, very regularly, but cats do enjoy having manual therapy done on them. So that's something that we really can do with cats. And then our one cat is giving the other cat a massage, but cats do indeed enjoy massage. I've never done any water massage in cats, but we do a lot of massage with our patients. And then acupuncture is another thing that we do a lot with kitty cats, and just have a little overview here for you. So pain relief, surgical analgesia, inflammation, we're going to use it for, muscle tension, and then osteoarthritis, hip dysplasia, IVD, we've used it for fibrocartilaginous embolisms with kitty cats, and also renal disease. So we do a lot of stuff with acupuncture and cats. And as I said, cats respond better to acupuncture than any other species. Many times people are very afraid to put needles into them, but a lot of times they are very fine. And if you use some of the calming points, that's a good thing to use. A lot of times I'm going to rub some lavender on my hand. Sometimes I use Rescue Remedy with the cats, but I do find that the acupuncture works extremely well with these guys. Oops. Yeah, I find that acupuncture works extremely well with these kitty cats. So we're going to talk just a little bit more about the use of acupuncture with the cats for osteoarthritis and for hip dysplasia. If you're doing that, a lot of times I am going to use electroacupuncture, and oftentimes I combine it with hydrotherapy and I combine it with laser therapy. I know that sometimes there are some people who are going to put in needles and laser the cat at the same time, and you can do that depending upon the laser that you have. Sometimes with your 4B laser, you can't do that, but you certainly can do that with your class 3 laser. Now, we need to think about how the acupuncture is working in these cats and why does it work so well. Well, we do realize that when we are doing things like massage and things like acupuncture and even things like laser, that what we are actually doing is we're affecting the fascia. So we are doing something called receptor-based therapy. So we are sticking our acupuncture needle in there, we are twisting it, and we're causing the fascia to be deformed. And if the fascia is deformed, we are then releasing a lot of local effects. So we're releasing some serotonins, we're releasing some endorphins, and we're also doing some gait pain theory with this as well. So those are the kinds of things that we are seeing are helpful with acupuncture. I have to say that I have never used it for surgical analgesia, but I have used it in rehabilitation of cats post-declaw. I'm not a huge fan of declawing cats, but I have had a few cats who have been referred to me, and actually this cat here is one of them. So I wanted to tell you a little story about this particular kitty cat who had some back pain, but the cat had been declawed. And I think that what had happened was that the cat had back pain and fell off of a railing. And when the cat fell off of a railing, I think he fell onto his back. But one of the reasons he fell was because he had no claws. But I had treated him previously after he'd had a declaw because he had post-declaw pain. And we actually treated him with acupuncture for that. And so then when he fell off the banister, his client brought him in to see me because the cat was so painful. And then what we ended up doing with him was we did some acupuncture on him, we did some laser on him, and he also really, really liked massage. So he would come in, he would get acupuncture, he would get laser, he would get massage. Later on, we ended up treating him with some Adequin so that he would have less pain in his joints because he started with some degenerative joint disease as he got older. He also had gained some weight, and so we ended up putting him onto a weight loss food. We did convince the client that he would be okay if we put him in the underwater treadmill, because we have used the underwater treadmill for cats who are overweight, and we have used it for weight loss, and it does work really well. Now, not all kitty cats are particularly happy to go into the underwater treadmill, but this cat was not too bad, so we did use that for him. And later, he has since passed away, but he did end up with some kidney disease, and so we did do acupuncture with him for kidney disease. So we did a lot of things. So if you're doing some feline rehabilitation, it's not an unusual thing that you're going to have to treat a lot of these cats with a lot of different things. So this is another kitty cat, and this cat's name was Bagheera. And Bagheera, who was attacked by a dog. And after Bagheera was attacked by a dog, he was really very badly shaken. And when he was badly shaken, he ended up with having some behavioral changes, and he was very, very afraid. And of course, he was having some issues with his hind end. He didn't want to pick up his tail, and he really ended up with a lot of pain and lumbosacral disease. So Bagheera, at the best of times, was a tiger, and we could not do too much as far as doing anything with him. He had a reputation of, when he came into the clinic, that he was a killer cat. However, we did do some acupuncture with him. This was probably one of the last sessions because there's not a lot of needles left in him. But he actually came to love having his acupuncture done, and he really, he very, very much enjoyed it. And I think he liked the relaxation that he got with that. And that's what we see with many, many of our acupuncture patients. So in summary, feline rehabilitation is something that you can easily do as long as you realize that cats are not small dogs and that they can be handled very, very easily if you're using some fear-free techniques. And you can apply all of the rehabilitation, well, not all of them, but most of the rehabilitation techniques that you have learned to the cats. You certainly can do therapeutic exercises with them. They certainly can do laser. They love acupuncture for the most part. and, and massage. Hydrotherapy, it's an individual cat thing as to whether, that's going to be helpful for you or not. So as usual, if you have any questions, please don't hesitate to post them to our message board. Thanks so much.